Hello and welcome to the Let's Talk About podcast, a series brought to you by Tallaght University Hospital with the support of the Adelaide Health Foundation. In this 6-part series, we're going to cover safer mobility and the various things that can affect our mobility as we age. In this first podcast series, let's talk about safer mobility and falls. Falls are a significant worry for older people. 1 in 3 people over the age of 65 will have a fall each year, and the risk increases with age. Over the course of the 6 episodes, I will speak with a number of colleagues at TUH who are experts in this area. We will talk about how we can improve mobility as we age, and how to reduce falls and injuries from falls, and if someone does fall, what we can do to help them. We hope this Let's Talk About podcast series will help older people, those who care for older people, and healthcare professionals develop a better understanding of falls prevention so people can stay active, keep moving, and enjoy life with confidence. Hello, my name is Paul McElwaine and I am a consultant geriatrician working in Tallaght University Hospital, and welcome to the 3rd episode of Let's Talk About Safer Mobility. I'm delighted to be joined by Helena Dolphin, a specialist registrar in geriatric medicine, and Christine McAuliffe, a clinical pharmacist.
Hello.
Today we will discuss the idea of polypharmacy and its role in falls. Medicines are a vital element of healthcare. For example, the discovery of penicillin changed how we would manage and treat serious infections. And I don't think I need to highlight the massive benefit that vaccine development has brought globally. But as we age, we are inclined to need to use more medications. So the question is, can you be on too many medications? So Helena, what is polypharmacy and why is it important?
Polypharmacy means being prescribed 5 or more medications, generally. It's an idea that's gained traction, particularly in the last kind of 2 decades, as we look at people as they get older and the medications that they're on. So a lot of people are prescribed medicines when they're in their 40s and their 50s. That's a general time in people's lives when they tend to start being prescribed things by their GPs, usually. And a lot of people are still on the same medicines then when they're in their 70s and 80s. For some people, this is entirely appropriate. But for some people, the medicines they were on when they were younger are no longer appropriate for them or necessary. So it's important to start to think about it as we get into our older years and when falls become more problematic, to start to look at a thing called polypharmacy. So regarding falls, we know that 1 in 3 adults over 65 have a fall per year in Ireland, usually. And they usually happen in their own homes. We also know that people who fall are more likely to be on more medications than those who are not falling. And the falls that these people get who are on more than 5 medicines are more likely to be serious, cause a fracture, cause admission to hospital. So there's a link that we're starting to look at and what we're trying to look at safely. I suppose it's important to think about, being on lots of medications. And sometimes this is entirely appropriate. There are specific conditions, so people with heart conditions, kidney conditions, cancers, all sorts of things, where it might be entirely appropriate for them to be on more than 5 medications. It might be completely fine. But every so often we do come across scenarios where people have been on medicines for a long time and it might not be suitable for them anymore. We also know, regarding falls and safer mobility, there are particularly culprit medications, but also just being on lots of medicines exposes us to the side effects and adverse drug reactions of those medications.
So what is it particular about medications that contributes to falls? Like what is the problem with them and being on too many?
That's a good point. So there's kind of patient factors and medication factors. So the person themselves, as they get older, and Christine is going to go into this in a little bit more detail, our body composition changes, but also our ability to walk safely, to get up safely, our propensity to dizziness increases. And there are a multitude of medications that can make that worse, but also just being on multiple medications, the additive effect of being on more than 5 medicines predisposes us to falls. We know that particularly in the TILD data that we have, so that's the longitudinal study of ageing in Ireland done at Trinity College, it looked at falls, it looked at groups of people who were falling, it looked at people over 75, and it found that they were about twice as likely to have a fall in the last year than those who, if they were on more than 5 medicines, versus those who weren't. So, it is risky. And it's something that we can do, something proactive about. That's why we look at it.
So let's name and shame. So what are the kind of culprit medications that we look at when people have come in with a fall?
Excellent question. So there's ones that particularly act on your brain, and they're obvious ones that could, if you think about it, something that's likely to make you a little bit more sleepy, a little bit more sedated. You're less likely to be alert, able to walk as well. You're more likely to fall over and have a bad fall. So sedative medicines that might be started for sleep, for anxiety, they're a particular concern. Also strong medications for pain. So strong painkillers, analgesics, they can be particularly problematic. There's other ones as well.
Yeah, as well as the medications acting on our brains, medications that affect our blood pressure can be problematic in older age. So when we're younger, we like to reduce our blood pressure to quite low, and it takes a lot of medications to achieve optimal blood pressure in younger patients. However, as we get older, this can be problematic. So blood pressure medications may need to be reviewed and potentially reduced in our older patients.
Okay, and I suppose it's important as well to highlight that a lot of the medicines aren't necessarily designed with older people in mind. Would that be fair to say?
Absolutely. So a lot of the trials would have focused on patients with one singular disease looking at a specific drug. However, our older patients we need to look at holistically because many of them have multiple conditions and they're on multiple medications treating various different conditions, but we need to look at the person as a whole. And in addition to this, patients included in trials tend to be younger. So we're often extrapolating the data for our older patients.
I suppose with your expert knowledge of how medications work, what is it particularly about older people that makes us concerned about being on lots of medications?
So for medications to work in anyone, they need to go through a complex process in the body. They need to be absorbed into the bloodstream, they need to travel to where they need to go, and then they're broken down and removed from the body by the liver and kidneys. And it's important to note also that as well as having benefits, as Helena mentioned, all medications can potentially cause side effects in anyone, but there are certain characteristics of our older patients which make side effects more likely. As Helena mentioned also, being on a larger number of medications increases your risk of side effects. However, there are some age-related changes that occur in the body that can also increase your risk of these side effects. So as we get older, we tend to have less muscle mass, and this can result in there being higher concentrations of medications in the body. And as well as that, our liver and kidneys become less efficient at removing medications from the body. So for all of these reasons, we often need to review medications in our older patients because sometimes medications will need to have their doses reduced or the frequency of times they're taken in the day reduced to compensate for these age-related changes. An example of a medication is flurazepam, which is a benzodiazepine medication, and it belongs to the sedative family that Helena mentioned. Flurazepam has been shown to last twice as long in the body of a patient over 65 versus a younger patient. And it is important that we recognise side effects of medicines as well, because side effects can sometimes be misinterpreted as a new condition, and therefore new medications can be prescribed to treat this perceived new condition. So as well as being on multiple medications increasing your risk of side effects occurring, having a side effect of a medication can lead to more medications being prescribed. So it really is a vicious circle.
Yeah, that's what we call that cascade effect of prescribing that we often get into, which is not great. So people at home are listening to this. What can they do to ensure they're taking the right medications, particularly if they've had a reduction in their mobility or a recent fall?
So there's a number of things you can do to ensure you're on the appropriate medications or someone you're caring for is on appropriate medications. If you're looking at your medications at home and you're thinking you're unsure what they're for, how to take them correctly, or indeed you're wondering what are the potential side effects of a certain medication, your community pharmacist is a great resource to reach out to, and they'd be happy to go down through your list of medications with you, explaining what each of them are for and how best to take them so that you get the optimal benefit and you reduce the risk of side effects occurring. So some medications need to be taken in a certain way, with or without food. Some are better taken in the morning than the evening, and your community pharmacist will be happy to explain all of this to you. If you're aware what your medications are for, but you've been on them a long time and you're wondering, do you still need to be taking all of these medications? Or indeed you suspect that you might be experiencing a side effect in relation to one of your medications, you should book in an appointment with your GP to discuss this. But it's important to stress that no one should stop taking any of their medications without first having that conversation with their GP and formulating a plan together.
Yeah. So always safety first. So don't stop anything unless it's
Absolutely.
with the advice of a specialist.
In relation to mobility and falls, if you're admitted to hospital following a fall, here in the hospital, the medical doctors and the pharmacists on the team will routinely review your medications to see whether any of them could have contributed to this fall, and they may make changes. However, at discharge, it's important that you're aware of the changes that have been made in hospital, as what can happen sometimes is a medication may be started on discharge, particularly after a fall, say a painkiller, where the intention is that you'd remain on this for a short period of time, but it can get continued indefinitely. So a good time to schedule an appointment with your GP for medicines review is in the short term after discharge from hospital.
Helena, from your experience in looking after older people, have you any top tips from that regard?
Yeah, I was just thinking there when Christine was mentioning. So after someone's had a fall and they come into hospital, that's kind of an ideal time for us as the hospital doctors looking after someone to have a look at their medications and see are they appropriate. So there's lots of tools now that we can use. There's a thing called the stop-start criteria, which was actually developed by a group of geriatricians down in Cork, and it's used internationally. We're very proud of it. So that can be used to have a look at someone's medications when they're admitted to hospital. We know from, kind of international data on it that for an unspecified group of people, if you look at their medications when they come into hospital, you can actually, by reducing their medications that they're on that aren't appropriate, maybe reduce their length of stay by about 3 days and reduce their adverse drug reactions by about 9%. So it's well worth doing this and picking the opportunity to do it. From a person's perspective, I've noted that often older people are delighted to have their medications looked at in detail and reduced if possible. Like a pill burden that's higher than 5 or 6 medications can be quite challenging, and if we can do anything at all to reduce that safely, we absolutely will.
So if you had a take-home message for the listeners today, what would it be?
So my take-home message would be, if you're at home, if you're looking after someone, or if you yourself are over 75, if you're on more than 5 medications, check in with your GP and just see, are they appropriate and are they at the right doses for you?
And I just like to highlight that there's a couple of key times where everyone could benefit from a medication review, particularly if they've had a fall or after discharge from hospital, where we may have made changes in hospital. So it's good to just check in with your GP following that to make sure you're aware of the changes made to your medication and the plan going forward.
Okay, Helena, Christine, thank you so much for talking with me today. Join us next time for episode 4 of the Let's Talk About podcast series, when we will be discussing the importance of bone health and nutrition in safer mobility. So grab a glass of milk and join us. Thanks for listening, and we will talk again soon.